being that we are a library in Port Washington, you are a resident in Port Washington. How long have you lived in Port Washington?
So I've lived in Port Washington almost 5 years.
And when did you know that the coronavirus was becoming a serious issue for our area?
Back in March of 2020.
What was it like working in our area during the height of the pandemic?
Mentally and physically exhausting, painful to see the pain and suffering that people were going through, and the deaths. Pain and suffering, not just for the patients that we were taking care of, their families who could not visit, and also for the frontline staff who were witnesses to all of what was happening. It was just unbelievable.
Yeah. Did you notice any of your staff or other workers starting to go through any sort of post-traumatic stress given those situations?
Oh, absolutely. We're starting to see a second wave, not to the extent of the first wave, but still very devastating. And, right now, staff would just break down and cry, having to go back in that environment again, having to call a family member on FaceTime and say, your family member is not doing well and potentially will die in the next few minutes, few hours, having to make those difficult calls, having to be the family at the bedside who holds the patient's hands while going through this terrible, terrible ordeal. It too has taken a toll on them mentally and physically.
So that actually led me to my next question, which you had answered. What are your thoughts about the frontline medical staff that have been working so hard all these months? Just on a personal note on my end, I lost a great aunt to the virus, and she was in a nursing care facility in Freeport. And it was very painful for us. For people who we were just we knew the staff at that point. She had been there for a while, to not be able to have that contact. But we were being updated by the staff, and you did notice the toll that it was taking, and how heartbreaking it is for them to have to tell people, family members, I'm sorry, you just can't come in and see your family.
It was in one of our facilities in Westchester. And, I felt so bad for my cousin who just had to be on the phone, never saw her after he dropped her off at the hospital. And she passed away, and it was incredibly painful for them to just not be there. Maybe there's something you wanted to say. On another personal note, I had a colleague of mine, we went to school together, reached out to me last week because she heard that her uncle was in the one of my intensive care units with what his girlfriend described as a viral respiratory infection. And obviously I couldn't confirm what his diagnosis was, and she didn't want to know, but she just wanted me, if I could, to deliver a message to her uncle stating that all the nieces loved him, and a personal message. And I was able to do that for her. So that meant a lot. And he subsequently passed away a few hours later. Wow. So I'm happy I was able to do that for her.
Yeah. Yeah. I mean, I imagine that many of your staff, including yourself, have stories like that. They've kind of had to bear the pressures of of delivering these last messages.
Right.
Yeah. What were your hopes and fears over the last few months?
Well, my fears were fearing that being on the front line so close up to this deadly virus, that I would get it myself. I was fearful because I live alone that I would be here suffering by myself. And I didn't know how it would affect me. So a good friend of mine, also in healthcare, who lives alone, we kind of made a plan that if she got it, I would go by her. She has a house. She would be in the basement if she had got COVID, and I would be upstairs just to look out for each other. And if I got it, that I would come over to her, be in the basement, and she would, care for me without being exposed, just so that we were not alone, because you don't know what would happen.
Right.
So I was fearful for my life. I was fearful that I would pass it on to my mom, who is elderly. I also had a grandson who was born in the peak of the pandemic prematurely. I was afraid that I would pass it on to him, with his little lungs so underdeveloped already. He spent 4 months in NYU NICU. So I was fearful about that. Those two people, because of their fragility and how vulnerable they are, I was fearful for that. And just for anybody else, because, in my profession or oath or goal is to preserve life and preserve health. So I would feel guilty if I was walking around spreading this virus to even just people I go to the supermarket and interact with. So that was my fear. My hope was that we would get some kind of relief in terms of a vaccine soon, that we would start to turn the corner and, we could get this virus under control.
So speaking of the vaccine, my next question was, when did you learn that you would be eligible to take this vaccine?
So the 13th, I got the vaccine on December 14th. I've been openly kind of stating that I am ready for this vaccine. This is what we need, volunteering myself. And on the evening of the 13th, my chief nursing officer called me and she said, I know you are interested in getting the vaccine. You have always been very vocal. I heard that the vaccine is coming to New York tomorrow, particularly to Northwell Health and Long Island Jewish Medical Center. Are you still interested? And I said, without hesitating, absolutely.
And this was the Pfizer vaccine?
I got the Pfizer vaccine, yes.
Okay. And so when you found out that you were eligible, what went through your head when you were obviously, I don't think it crossed your mind not to do it, but from what was going on in the news, there was a lot of mixed messaging. A lot of people were very hesitant. Did any of that sort of information kind of get to you in any way that maybe you took a second guess and said, maybe I should hold off on this? What
Never.
was going through your mind?
Never. My mind was made up that I was going to take the vaccine. I see this as the way forward. I saw it that, wearing our masks, social distancing, meticulous hand hygiene, those are preventative measures. And it will help the spread, but it will not give us the impact that we need right now in this global crisis.
Right. And many people know that the Pfizer vaccine is a 2-part vaccine. So just to confirm that you've already had your second vaccination.
On January 4th, I got my second vaccination.
Okay. And did you experience any sort of issues after taking the vaccines?
None after either doses.
Okay, great. I think that's a really positive message to put out there for people who also qualify and maybe are a bit hesitant to take it.
And just to know that the only kind of side effects that I've heard of, people said they felt a little weak and out of it and a little foggy, lasting less than 24 hours, mild fever, all of which pales in comparison to the symptoms of COVID.
Right, sure.
Yeah.
So I was kind of checking the numbers. I follow Governor Cuomo on Instagram and social media, and it's very comforting to see those reports comforting in the way that he gives us the numbers. He gives it to us straight. And from what I saw from January 17th, there are many new cases, at least 194 new fatalities, unfortunately, and over 13,000 new cases were reported in New York on January 17th. What are your hopes for the Port Washington area in the coming months, given that the numbers are rising?
Well, I hope that, like you, people follow the data because data is powerful. It tells the story. And I am happy that Governor Comer's leadership has been really extraordinary, telling us what we need to know because we need to know the truth. And I hope that the Port Washington community really follows the data, gets it from reliable sources, really see what's happening, that we are not out of the woods yet. We still need to continue to follow the guidance of the experts. So CDC, all our physician expert, infectious disease experts that have been on television, kind of guiding us on where we are, what's the best course forward. I am hopeful that the Port Washington community will come together and do their part in making a difference. And that means getting vaccinated. If you're still on the fence, get information, be informed, ask the right questions, be curious. It's fine to be curious and ask questions because we understand that getting vaccinated is a personal choice. There are people who are hesitant because of history, and that should not be dismissed because it's relevant and we should acknowledge that and also take the opportunity to educate people on how, since those harmful, painful, hurtful studies or treatments were done, vaccinations has led us through some other dark times in our lives. And so that is what we need right now in this darkness to lead us out of this darkness that we find ourselves in globally. I would also inform them that unlike some of the other studies that were done on a smaller scale and in isolation, on this one, the world is watching. It's affecting the entire world. This virus has shut down the entire world. So the entire world is watching. For those people who are, scared that this was done too fast, vaccines traditionally take years to be developed. With science and technology, I think we ought to be grateful that it came through for us this time and that this is part of living in a modern world. And when you speak about living in a modern world and how science and technology has advanced, or look at our cell phones. From we wake up in the morning until we go to bed at night, science and technology is interacting. And it's the same thing that happened here with the development of the vaccine. So I'm grateful that it was created in record time to deal with this global crisis that we find ourselves in.
Yeah. Well, we have a few minutes left, I think 1 or 2 minutes left. And this is something I really wanted to ask in the beginning, but I wanted to make sure we got through all of these questions first. What led you to become a nurse? What led you through this career path? Because I think it's very similar to teaching, that it's a calling. It's something that someone doesn't enter into very lightly. So I'm just very curious, what led you on this career path?
I'm Jamaican immigrant, and in Jamaica, my siblings and I were raised by our grandparents. My grandmother had some chronic illnesses, and so I would take care of her, administer her medication, and so I was playing nurse and kind of dreaming from back then. Additionally, the nurse in our culture is seen as a respectable kind of profession. The matron is kind of the matriarch in the hospital setting. And so I was drawn to that. And funny you mentioned education, because my grandmother was a school teacher. And so I love teaching as well. I used to, just play school, like line up some chairs, like I'm teaching. I loved writing on the chalkboard. And so now I get to kind of enjoy both nursing, and a big part of nursing is educating as well. So it worked out really well.
Great. Well, on that note, we just made it to the 20-minute mark. I'm glad we were able to get all these questions answered. And again, thank you so much for your sacrifice and the work that you do. And thank you for sitting with us.